Okay, so I think we are going to live now and we're going to start. So hopefully that all of you have joined. So within 1 minute, we are going to start. So hello, all of you, and we are going to live now. Thank you so much, Dr. Sunil, sir, and the team Nextillo for providing us this platform to interact with the students on a very important topic of today's discussion, that is of forensic and radiologists. They both are together to make you have interactive sessions. So how this forensic radiology is going to be applied in a day-to-day life and clinical point of view. So dear students, the friends and all the colleagues, we are going to start today with this forensic radiology point of view. So myself, Dr. Tejas Prajapati, I am a forensic medicine expert, and we are with Dr. Rajendra, who is a radiologist. So welcome, Dr. Rajendra, to the Nextillo platform, and we are going to start right now.
Thank you, sir.
Yeah. So today's topic is almost a very important topic for the students to understand, because identifications of the person who is unknown and unknown person's identifications in medical legal point of view, whenever that any unknown person comes to the hospital where the identity is going to be established, the role of radiologist comes a very important role, because we have to take some x-rays, we have to take some age estimations and all these things combinedly for the establishment of the identity. So we are going to just take a brief review and we just touch upon the topic in the next 1 hour, so that all of you can understand that what is the importance of forensic radiologists together. So the children and the young adults under the age of 25 years, we are having this points of identifications, that is of dental, radiological, journal examinations and other examinations. So friends, we are going to focus today on the radiological examinations, because this odontology is again a very important thing. It's a dental science, and we all know that we have to look at the dental x-rays also, which mark major features on the dental chart provided, because we all know that we are having the look for the cavities, fillings, bridge work, missing teeth, and so many things. So that's how also either in a dead person or a living person we can have identity of the individual. So that's why the dental x-rays are also very important aspect. Whenever you are suspected that identity is going to be established for any people who are having this kind of cavities, fillings, bridge work or the missing teeth. This is some of the temporary tooth, as we all know. this, this is eruption. I just mentioned the eruption months and the permanent tooth when it is erupted. So accordingly that you can also see into the dental x-rays where you can have more understanding that this tooth is erupted or not, and whether this we are using the OPG, that is a view of the x-rays from the dental point of view, and accordingly that you can also understand the tooth is erupted or not. And temporary and this permanent teeth, they have got a two difference. Temporary are the small, narrow, light and delicate. The permanent one is a big, broad and heavy and strong. So that's why the age estimation after completion of the eruption of teeth, that is also very important. That is with the teeth is GUSTAFSON'S, Bode's, Points formulas, Tex formulas, or the Miles formulas, which is a microscopic examinations, which in X-rays also you can see the attritions, periodontosis, secondary dentin formations, cementum appositions, root resorptions, or the root transparency. So we'll not go into the tooth of much today, because we have to see the most important. We can also comment on the bite marks also from this kind of tooth exposures, but we are today more focused on this radiological examinations. So because this is what in general identifications of the individual what we are talking about. So after the some of the important age group, which is very important to understand, like at the age of 8 years, 12 years, 15 years, 18 years, 21 years, 25 years, like that. These are the very important age group that is in our life, where that is a medical legal importance of that particular age group. That's why any patient comes to us in an emergency department, either a clinical patient, like in a case of sexual offenses, where we are having a victim of rape or the accused of rape. At that time, if you are not sure the age of that particular person, then we have to confirm it with the radiological examinations. So that's why these are the age groups are very important. And friends, we have to understand that radiological examination must have to be applied to the point at that particular time, so that not a single X-ray is missing, or you can say the evidence collection should not be missed at that particular time. If we are missing some of the taking X-rays or the radiological examination, then it is very difficult to prove in the courtroom that this person is of the same age group or not. So that's why the radiological examinations is very important. Age, and from the radiological examination, what we are actually looking for, we are looking for the age from the ossification activity of the bone. The bones of the human skeleton, we all know, develop from an ossification centers. At the 11th week of the intrauterine life, there are around 806 centers. At birth, about 450 centers. We all know the adult human skeleton that carries only 206 bones. But the time of appearance of ossification centers and the process of union of this epiphysis with the diaphysis have sequence and the time period which generally utilized to estimation of the age. That's why the student says we have to understand in X-rays the epiphysis and the diaphysis fusions. We are having a radiologist also, so we will understand more and more and that how you will read it out the X-rays. That's why the determinations of the age of the person from appearance and the fusion of the ossification center, a radiograph, X-ray, you can say the base confirms the ossification pattern or the union of the ossification centers in the skeleton bones. For estimation of the age, skygrams of different joints, that is what needed, like shoulder joints, elbow joints, wrist joints, hip joint, knee joint, ankle joint, pelvis and skull. That should be taken in an anteroposterior direction, that is of AP directions. That's why, friends, we have to make the understanding that what are the ages which is common at what these joints, epiphysis and diaphysis fuse together, so that we have a better understanding that this age group requires this kind of skygrams or the X-rays to be taken at that particular time. Okay, like ideal site recommended for the radiological study of ages of medical legal importance. Suppose if we have some patients or some cases from the forensic experts like infancy and childhood, like a battered baby syndrome. Okay, some child may be neglected by the parents and that been thrown away to the roadside. We may found sometimes a dead-born fetus also. So in that particular time, we should require to confirm the identification like the age estimation, wrist and elbow joint is a must. Adolescence phase, it's a very important phase in the life from the medical legal point of view. During this time, we are having like kidnapping, we are having a sexual assaulted, we are having any other crime related to the minor group of the children. So that may be decided accordingly the court of room, whether that person is adolescent or not. But for that, we require to be confirmed with the X-rays of pelvis, hip, shoulder, and elbow. Okay, friends, and an adulthood and old age, that is more on common sites on the skull, because we are having a sutures in the skulls, which must have to be fused at the particular moment of time. So we have to understand the when the skull sutures been fused, and accordingly that you can give your opinion of the age of the person. So these are the very important ideal sites recommended for the radiological study of the ages of medical legal importance. So like this is some of the appearance and fusion of the epiphyses. One, that is if you can see here, that is of scapulae, clavicle, and the sternum. Here the A, B, C, the three important diagrammatic presentations, if you can see. So here, if you can see and just notice, A, that means appearance, and the F, that means fusions. And that years that has been written is the age of the individual, age of the human being, you can say. So a different part, if you can see in the sternum also. So sternum before birth, they may go into this 5 months of intrauterine life that has been started appearing in the center. And this fused with the manubrium sterni to the older age, 14 to 25 years also, that may be fused. So like that, if you can see the scapulae, that is clavicle, medial and lateral and each and everything that has been written here. So accordingly that we have to take a X-rays. And X-rays, you just understand that whether this part of that particular joint appears or the fuse. If it is appears, then what will be the age of the person? If it is fused, then what will be the age of the person? Like this is a various part of the sternum, as I told you. This is the, you can say, manubrium to the body of the sternum. That is old age, like 60 years. And after that, if you can see first, second, third, and fourth, like 25, 20, 15, 40 years. And last one is the episternum. So that is how you can see in the sternum bone also, whether that has been fused or not. And accordingly that you can give the age group of that particular individual. Like shoulder joint, as I shown you into the diagram, that epiphyses, appearance, and fusions here. Head of the humerus, epiphyses, that appear between that 1, 3, and 5 years, and composite, the fusions, 5 years with the shaft with the 18 to 19 years. Okay, so that means if your head of the humerus is fused with the shaft of the humerus, that will give you the age is around 18 to 19 years of age. Okay. The similar way, the tip of the coracoid process of the shoulder joint, and that is appeared around 10 to 11 years, and that is fused tip of the coracoid process will be 16 years. So if you're in an X-ray, if you're taking a shoulder joint X-ray of some of the persons whose age is not known, and if you're suspected that is an adolescent age, and if you have taken a shoulder joint X-ray and that shows appearance only the tip of coracoid process and not fused with the shaft, then that will be 10 to 11 years only. Tip of the acromion process, which appeared 14 to 15 years, but fused, it may be around 17 to 18 years. So Friends, this is going to be very interesting actually, and very important also. Suppose if your radiologist is giving this kind of appearance or fusions, then that will be very important from the forensic point of view and a court of law. If the radiologist have given this appearance only, not fused, that means the age group will be different. Okay, and accordingly that, another simple example, students, for your understanding, for why that we are doing this exercise today. Because if some person has committed some crime and if he is minor and you are not sure of the age of that particular person, and if you have written down that the age of the person is 18 years but he is actually a 16 years, then the punishment will be totally different, because a minor's punishment will be a different compared to the major's punishments. So that's why we have to understand this thing in detail. The same thing, this is a humerus radius annula, the appearance and the fusions of the joints, that is of elbow joint. So in elbow joint, the medial epicondyle humerus will appearance around 5 to 7 years, with the fused with the shaft maybe between the 14 to 16 years. Similarly, the lateral epicondyle of the humerus, 12 years appearance, and the capitulum will be 1 year appearance, and that is with the capitulum fused with the 14 to 16 years. Trochlear with the humerus appearance around 9 to 11 years, and with the capitulum that is fused with maybe around 14 to 16 years. Head of the humerus, head of the radius will be appeared maybe around 5 years and fused with the 16 to 17 years. Tip of the olecranon process 11 to 13 years and fused will be 16 to 17 years. So again, this is an elbow joint which is very important for the adolescent group of the people, and that's why we have to take this elbow joint x-rays whenever you confirm that this is the age group of this individual. If you can see, most of in elbow joint, the fusion may be occur around 14 to 17 years of the age. So if your elbow joint is completely fused with, you can say, the medial epicondyle or lateral epicondyle with the shaft or the capitulum or the head of the radius and olecranon process, so all on average, the individual's age will be the 14 to 17 years of age. Okay, so that is the importance of the elbow joints. Here again, this is another appearance of the fusions epiphysis in the bones of the hands. There are so many bones, but the important thing from the radiological examination, the pisiform. The pisiform bone, which is appear in the 9 to 11 years of age. This is going to be a very specific appearance of the pisiform bone, and that's why this is going to be a very important medical legal landmark also. If you are not sure that person's age between this 9 to 11 years, you just take an x-ray of the wrist or the hand, and you just confirm whether the pisiform is appear or not, and you just confirm if it is appear than 9 to 11 years of age. So lower end of the radius in the wrist joints, which appearance around 1 to 2 years, fusions maybe around 16 to 19 years. Lower end of the ulna, 5 to 6 years, fusions around 17 to 18 years. Pisiform, as I told you, that's only appeared, it is not fused, 10 to 12 years or 9 to 11 years, you can say. Base of the metacarpal and head of the metacarpal, 2 to 3 years or 1 to 1.5 to 2 years, and that fused maybe around 15 to 19 years. So here also, the wrist joints is very important for the adolescent point of view, like 16 to 17 to 18, 19 years of age. So now I think we required the help of our Dr. Rajendra, who is a radiologist. So sir, if you can just focus on this X-ray and try to make our students, because this is an ossification centers at elbow, and we have just marked this C, R, T and all this thing, and you just try to make our all the friends that how you are taking an X-ray or how you are interpreting the things from this kind of elbow joint. Yes, please, Dr. Rajendra, if you just throw a light on this X-rays.
Thank you very much, sir. Kindly, I would like to share my screen.
Yeah, please.
Give a better understanding for the students. Thank you very much, Dr. Tejas. Kindly Nextillo team, kindly let me share the screen.
Should I stop the share here?
Sure, sir. Thank
Yeah.
you, sir. Thank you for that.
Yeah. Yeah, host, if you can please allow Dr. Uh, Rajendra to share the screen. Yeah, Dr. Rajendra, you are host now. You just share your screen now.
Thank you, sir. Just wait for a minute. Um, just one second, sir. Okay. Thank you very much, Dr. Tejas, and special thanks to Dr. Sunil and the Nextillo team. Okay, now let's talk about this. What is the importance of radiologist in these kind of things? As we have gone through the list, what is will be the age of appearance, how they are going to look as ossified. So let's talk about it in a sequence way. Okay. This part has been already covered by our forensic specialist, Dr. Tejas. So let's talk about this. Now look at this X-ray. Okay, you have been provided with this X-ray and you are being asked for the age estimation. See, we have already seen in this slide that this first part will be get fused when the age will be more than 60. Now look at the second part, 25 years, third part, 20 years, fourth part, 15 years. So what is the importance of this? You have to remember these kind of things. Okay, this is the point where they are going to be fused. But now let's talk about what is going to happen when you are going to practice. Let's see. You have been provided with this X, okay, and you have been asked about the age estimation. Okay, now look at this. Can you see this? That first part is unfused. Okay, students, can you correlate this? This first part appear unfused. Now look at the second part. Okay, can you see this radiolucent line over here? It means this part is not fused yet. Now look at the third part, and now finally to look at the fourth part. So now let's have a look to this one. First, second, third, fourth. So we are able to see at this fourth part. So age will be less than 15 years. Okay, this is how radiologically we are going to say age is less than this or more than this. We are radiologically we cannot say that this would be the age. We only get the hint. Okay, if ossification center is there, you on the basis of absence or presence of the ossification center, we can give a range of age. Okay, that it would be less than this much here. So looking at this X-ray, I can say that the patient is less than 15 years because of the non-united segments. Now, look at the next one. We have discussed this. Now let's have a look how it is going to help us in the diagnosis. Now look at this X-ray. This is a frontal radiograph for the shoulder. Now look at this. What could be the age of this patient? Okay. Now look at the shoulder joint and have at the head of humerus. The head of humerus is not fused yet. Okay. Three parts are there which are appeared at 1, 3, and 5 years. Okay. But the head is not fused. So the age will be less than 19 years. Now correlate with this one, head of humerus. Sorry, head of humerus. Fusion kab hoga? 18 to 19 years. And you get an X-ray like this. So what we are going to comment? We are going to say that the age will be less than 19 years. Okay. Now look at this. You got an X-ray like this for the shoulder for age estimation. And they are asking you regarding the age. Now, compare this with this X-ray. Can you compare? The first X-ray, there was no fusion at all. Okay. Have a look. This part is not fused yet. So it was less than 19 years. Now compare it with this. Now you can see that the head of humerus is fused. So united head of humerus, the age will be more than 19 years. Okay, students, any doubt? Now, let's have a look to more. Now look at this X-ray. Okay, these are the X-ray of the infants. Now look at this first and second X-rays. Go for these bones. What are these? Wrist bones. Okay, only two are there. Okay, then कौन सी bones होनी चाहिए and what should be the age? The first bone is the capitate. Our age of appearance is 2 months. Okay, so we are able to see the capitate. Okay, two bones are there. So age is, according to capitate, age is more than 2 months. Now, second bone to appear is hamate. Okay, so if we are able to see two bones and the age of appearance of hamate is 1 to 2 years, so we can say that this, according to these X-rays, the age is less than 2 years. Okay, so we can see it's a 18 month and 20 months. Now let's move to the next. Look at this X-ray. This one. How many bones are visible? 1, 2, 3, 4. For the infants, wrist and elbow X-rays are very much important. So you are able to see 4 bones out here. So what would be the bones? Capitate, hamate, triquetral, and lunate. The age of appearance of triquetral and lunate is 3 to 4 years. So we can say, okay, the age is more than 4 years as all 4 are visible. But the next bone which is going to appear will be the scaphoid, which is around more than 5 years. So age will be less than 5 years. Okay. So on the basis of number of bones which are visible, we are going to tell it with our chart and we will be able to say that this child is going to be less than this much age. Now let's move to the next one. See, the first X-ray is of 13-year and a 15-year kid. Now look at the X-ray of the 15-year kid and try to count as all the bones are visible. Okay, even the pisiform is visible. So what we are going to say, according to us, pisiform appears normally 9 to 11 years of age. And if we are getting an X-ray of a patient, okay, of a kid, which has the presence of pisiform, it means the kid is more than 11 years of age. Okay. Now look at this X-ray. Okay, in this, there is a typical, we have been provided with an X-ray of an elbow joint. Why it is important? Because there is a typical manner of appearance of ossification center. Okay, the first ossification center to appear is denoted by the C, capitulum, which is appear around 1 year. Okay, so they have a specific age. This is capitulum. This is head of radius. Okay, oligoclonal process, internal. Okay, internal or medial epicondyle and lateral epicondyle. So when we are going to see an X-ray like this, what we are going to do, we will have our chart with the ages and we will try to find out which ossification center is present. Okay, like if only capitulum is there, then it appear around 1 year of age. So we would be like, okay, head of radius appear around 3 years. So the age of child will be less than 3 years, but capitulum is present. So the age will be more than 1 year, less than 3 years. What if all of these are present? The last one will be the external or lateral epicondyle. If in a patient, lateral epicondyle or external epicondyle, can you see this? Here you will see an ossification center. If it is present in a patient, then the age is likely to be more than the 11 years. Okay. So we are going to see which part is present and which is not visualized. And on basis of that, we will be able to say, okay, age of patient will be more than this. Any doubt, students? Kindly let me know. Now, have a look. Now, sir, can I continue this? Dr. Tejas?
Yes, Dr. Rajendra, please continue.
Okay, sir. Now, kindly look at this one. Now, important one is head of femur, which has an appearance at around half an year to 1 year and fused composite at the 17 to 18 years. Same with the greater trochanter and the lateral trochanter. Greater trochanter will appear at 4 and fuse at 17 to 18, and lesser trochanter 12 to 14 years age of appearance and fuse at 17 to 18 years. Okay. Now, what is the importance of this? Let's see. You got an X-ray like this. Okay. Are you able to see? Now, if we want to know about what is the age of the patient, can you say this? This is the femur. Okay, students, this is the femur. Can you see this dot? This white dot out here and one white dot out here. What is this? This is ossification center for the femur. Okay. Any other dot is visible? We have seen that head of femur. The ossification for head of femur is around 1 year, and there should be greater and lesser. So 4-year greater and 12-year lesser. What we are able to see only one, which is for the head of femur. तो बच्चों पेशेंट्स की एज कैसे देखेंगे इसमें? What will be the age? More than 1 year, because ossification center of head of femur is there. Next क्या आना था? Greater trochanter at the 4 year of age. Are we able to see any greater trochanter? No. So our range of age will be more than 1 year, but less than 4 years. Okay. So this is how we usually use this data. Now, wait for a minute. Sir, you can continue if you like. I have shown the students how these things are used for the purpose of age estimation. Dr. Tejas, you can continue from here. Host, kindly transfer to Dr. Tejas.
Yep. Yes. So hopefully that you can able to see the screen now.
Yes, sir.
Yeah. So very nicely narrated by Dr. Rajendra, as you know that how that we are going to see the X-rays. Like this is in the hip bone also. He just shows the pelvis with the femur also. So that's how we must have to understand the age of appearance and age of fusions. Like this, and this is the arm. Here is an adult, means a person who has completed 21 years. It is an X-ray of pelvis and femur in a 2.5-year-old male. Okay. This is again appearance of femur, tibia, and fibula, like knee joint. You can say the lower end of the femur, which appear at or just before the birth, and which is fused. Here, the knee joint is very important for the fusions of 18 to 19 years of age. So upper end of the tibia at or just before the birth, like lower end of the femur and upper end of the tibia, almost the same appearance and fusions. Upper end of the fibula, which is of 4 years of appearance and 18 to 19 years of fusions. Patella, that is of 3 to 7 years of appearance. So ankle joints, that is almost very important, but if you can see ankle, lower end of the tibia, which is of 1 year of appearance, 16 to 17 years of fusions. Lower end of the fibula, that is of 1 year and 16 to 17 years of fusions. Rest of the bones in the ankle joints, they are more towards, you know, birth of 1 to 2 years of age, like internal cuneiform, medial or external cuneiform, and the calcaneum, cuboid, and talus, that is at birth, 6, 9, and 16 intra-uterine life, you can say. Navicular around 2 years of age. So this is the bones of the foot. Important one here, the cuboid, which is of 9 intra-uterine life, 9 months of, and this is our ossifications of the skull by the suture skulls, and that is also very important for the old age people, you can say, an adult or old age people. Anterior frontinale fuses by the 2 years, posterior frontinale, which is fuses by the 6 months. Sagittal suture, we are having a posterior 1/3, which is closing age is around 30 to 40 years of age. Sagittal sutures, which is anterior 1/3, which is 40 to 50 years, and coronal lower half is around 40 to 50 years, the same. Sagittal middle 1/3 and coronal upper half is 50 to 60 years of closing age, and basi occiput and basi sphenoid, its closing age is around 22 to 23 years of age. So students or friends, that we have to understand the sagittal suture, coronal suture, and basic occiput and sphenoid. Sagittal, we have divided into the posterior 1/3, anterior 1/3, and middle 1/3. So posterior 1/3 is 30 to 40 years, anterior 1/3 is 40 to 50 years, and middle 1/3 is 50 to 60 years. And in coronal sutures, we have divided in upper half and lower half. Upper half, the coronal lower half is around 40 to 50 years, and the coronal upper half is around 50 to 60 years of closing age. That's why this skull diagram is very important for the old age people. So, Dr. Rajendran, would you like to share any other X-rays, or do you have any comment on this old age people's sutures point of view? How do you look after this, or do you have any other X-rays, Dr. Rajendra, to show? Yeah, Dr. Rajendra is there. Dr. Rajendra is there. Okay, I think he must be somewhere. So, students, this is a very important thing, as I told you, that this is all the important parameters of our, you can say, forensic radiology point of view. We have seen a different things like this X-ray. Again, I'll just quickly go through so that you can understand. We have seen the ideal recommended for the radiological studies, infancy, in childhood, adolescence, and adulthood. Then we have also seen this sternum diagram, the shoulder joints, elbow joints, wrist joints, appearance and fusion. This is an elbow joint, what we have seen. And we have seen the pelvis with femur also, iliac crest, initial tuberosity. This is 2.5-year-old male X-ray. Then we have seen the knee joint and ankle joint and the skull suture fusions. Okay, so now students, a very important aspect to understand why we want to have this, X-rays or the age estimations of the individual. We have to understand the medical legal aspects of age. Okay, like third lunar month, till this duration, decisions for the termination of pregnancy can be taken by the doctor. Okay, fifth lunar month, the maximum period of gestations for the use of indications for the MTP Act, and above this age, termination is only therapeutic on ground. That's why students, our friends, whenever we are suspecting this kind of, and we just have to confirm it with the diagrams or the radiograms, we have to take it and we have to submit it in the court of law that this was you can say the third lunar month or fifth lunar month or any other thing. Seventh lunar month, a fetus born after this period, if it does not show any signs of life, term as a stillborn fetus. Seventh calendar month, that fetus is considered to be a viable. 10th lunar month, at this age, it's a full-term baby, should be considered. Now 5 years, very important. Above this age, child becomes responsible for his act leading to the wreckage of the train according to the Railway Act. 7 years of life, below this age, child is not responsible for his criminal act if he does not understand the nature and the consequences of his act. That's why it's very important. As we have discussed that 7 to 12 years of age, which are the important X-rays must have to be taken, so that if you want to take some decisions, suppose child is not responsible for his criminal act, and suppose his age is 7 years, and below this age, he cannot understand the doing of any criminal crime. 7 to 12 years, criminal responsibility. A child may or may not be held responsible for his act by the court of law, depending upon whether the child has attained sufficient maturity to understand the nature and consequences of the act. That is of section 83 of Indian Penal Code, which is described this criminal responsibility of a child. A child below 12 years cannot give a valid consent to suffer any harm which may occur from an act done in a good faith and for its benefit, as general physical examination by the doctor. So that is of Section 89 Indian Penal Code. So 7 to 12 years again are going to be a very important age group if we have to describe the criminal responsibilities, or the child has to give consent for any kind of medical procedures or anywhere else. He should not, below the age of 12 years, cannot give the valid consent. And child may or may not be held responsible for his act by the court, depending upon whether the child has attained the sufficient maturity to understand the nature and consequences of the act. Another important age group is 10 years of age group. Because of 10 years, kidnapping to constitute a crime of kidnapping or abducting a child with the intention of taking dishonestly any movable property from its person, the age of such child should be believed to 10 years. Okay, so that's why this is again going to be a very important, should be below the 10 years of age group. Otherwise, that will be considered as a kidnapping charges. Then 12 years of life, the consent of a child below 12 years is not a consent, as it's intended by any section of Indian Penal Code, like Section 19 Indian Penal Code. If a man rapes his own wife and her age is less than 12 years, he will get punishment as he raped any other girl. The sentence is not less than 7 years or may extend to the life also under Section 376 IPC. So, students and friends, if you are not suspecting this child age or any person's age, maybe around 12 or 14 years of age, you must have to go for the X-rays. Once you will confirm the X-rays, and if you can see that the man, even the man's his own wife, then also that will be committed as a rape of the individual, and that comes under the Section 376 Indian Penal Code. 14 years of age, we have seen which are the important joints which X-rays must have to be taken, because a child below 14 years of age cannot be employed in factory jobs according to the Indian Factories Act 1948. That's why we have to be very careful. If the police person comes with you, with the person maybe around looking after 12 years or 16 years or 17 years, and if you're not taken the X-rays, you cannot say that the child's age scientifically. So that's why a child below the age of 14 years cannot be employed in the factory jobs according to the Indian Factories Act 1948. 15 years of importance. Sexual intercourse with one's own wife, even with her consent, is rape if she was below the 15 years of age. So here, Section 375 Indian Penal Code, it's going to be a very important aspect, because if some girl has run away with some boy, and after that they have willingfully married, and they are willingfully, with consent, they perform the sex, but if they have not, particularly the girl had not attained the majority, that is below the 15 years of age, even though if it is with consent, the sexual relationship will be considered as a rape, and that should be punished according to the Section 375 Indian Penal Code. A child above the 15 years and below the 18 years is an adolescent, and that's why the child is person who hasn't completed 15 years, so that will be considered as an adolescent. So that's why the 15 years of age is going to be a very, very, very important. So hopefully that 10 years, 12 years, 14 years, and 15 years of age group that you people understand. 16 years, again, that is going to be very important statutory rape point of view. Sexual intercourse with a woman, even with her consent, is rape if she was below 16 years of age. Taking away a male under this age without consent of, you can say, without consent of this the guardian. Okay, so that's why here the 16 years, we have to understand the two important aspects. The one, the sexual intercourse with a woman, even with the consent, is considered to be a rape. Okay, and that is of below 16 years of age, that is considered as a rape. But taking away a male under the age without consent guardian, that is also considered to be a kidnapping. 17 years admissions in any kind of colleges. 18 years, again, a very, very important age group to understand. Whoever takes, 18 years of, that is whoever, sorry, 18 years. So that is whoever takes or entices any minor under the 18 years of age, if a female, or under the 16 years of age, if a male, or any other person of unsound mind, out of the keeping of the lawful guardian of such minor or person of unsound mind, without the consent of such guardian, is said to kidnap such minor from a lawful guardianship. So that is very important also, according to the lawful guardianship section 361 Indian Penal Code. A person attains majority when he or she attains the age of 18 years. Whoever procures any girl under the age of 18 years for the purposes of illicit intercourse with another person shall be punishable with imprisonment, which may extend to 10 years, or and shall also be liable to fine, according to the section 366 Indian Penal Code. So, dear friends, this 18 years of age is also again are going to be a very important aspect, where we have to understand the rape, or according to the lawful guardianships, if the person or the male is not there, then that will be considered as a kidnapping of such minor also. So 18 years, again, a person under the age of 18 years cannot give a valid consent, whether expressed or implied, to suffer any harm which may result from an act not intended or not known to cause death or grievous hurt, according to section 87 Penal Code, Indian Penal Code. Whoever buys, hires, or otherwise obtains the possessions of any person under the age of 18 years for the purposes of prostitution or illicit intercourse with any person, or for any unlawful or immoral purposes, shall be punished with imprisonment of either description for a term which may to extend 10 years, and shall be also be liable for the fine under the section 373 Indian Penal Code. So below 18 years, again, you have to verbally and officially follow the many rules and regulations, because once that adult is a person who has completed 18 years, a person less than 18 years but more than 15 years, that is considered as an adolescence. So I think, friends, we have tried to understand the many important things of 18 years also. So almost all the age starting from the third lunar month to the 18 years of age group. So hopefully, students, that you understand why this forensic radiology point of view we have to understand. So if you have any, you can say the questions, doubts, suggestions, then we can take right now. Okay, I think we will wait for 4 or 5 minutes. If you have got any questions, doubts, suggestions, then we can take it right now. Okay, so or we have just tried to touch upon this the forensic radiology aspects, with how you are going to have this X-ray examinations, how you are going to, which are the important age group, which are the important joints of the X-rays, where you're going to perform the X-rays of the joints, and you will comment on how these X-rays are to be comment accordingly. So yes, any questions, doubts, suggestions regarding this, then please let us know right now. I am waiting for 5 minutes. If you have got any questions, doubts, suggestions, then we can take it right now. Yes, any questions, suggestion, doubts? Hello. Yes, students. Okay, so hopefully that you have understand this from the third lunar months to the 7 years, 7 to 12 years, then 10 years, 12 years, 14 years, 15 years of medical aspects of age, 16 years, 17 years, and 18 years also we have seen. So almost each and every age group we have seen. We have understand the X-rays, which are very important X-rays to be taken during the joints. We have also seen which are the appearance and which are the fusions of different epiphyses. Yes, please. Any questions? Any questions from the students? Please, you can write it down in the chat box, or you can also write it down in a live this link, so that we can answer you whatever the questions that is in your mind. Yep. Any questions? Any questions, doubts, suggestions? Yeah, host, if you can also transfer the questions, because I'm also looking after in the YouTube live chat also, but there is no questions at present. Even here in the Zoom platform, there is no questions presented here. Okay, so I think we have finished now, and thank you so much for Dr. Sunil Shah and the team of Nextillo for providing us such a big good platform to interact you with all the students, and hopefully that in the future also we are going to have some more and more good topics to be discussed, and that's how we just transfer the knowledge as much as possible. Okay, students, so I just would like to say thanks to each and every person to appear here and make this very wonderful chat of, you can say, last 1 hour with the forensic medicine and the radiology point of view. So hopefully that now onwards, you know that whenever you are going to take the X-rays and you understand the forensic medicine point of view also, the legal point of view also, this is going to be very important. So that will be suffice our today's program. Yeah. So any other things to be discussed, please let me know. I'm waiting here. Yeah, any other questions, doubts, suggestions? Yes, please. Okay, then, friends, hopefully that in a near future, we are going to have another good interactive program with all of you. And we're going to leave now. Thank you. Thank you so much for attending